Hi, my name is Pritam Steiner, and this is a short infographic poster presentation on infant mortality rates in India and the relationship to young maternal age and short child spacing intervals. I want to start by looking at the data here. 1 in 14 births to young mothers in India ends in the death of a child within the first year. Now, just to gain a global perspective of infant mortality rates, in the United States you see about 6 deaths per 1,000 live births. In Brazil, 12, Argentina also 12, in Algeria 22, South Africa 33, in China 11, and just 3 in Australia. However, when we look at India, we see a total of 41 deaths per 1,000 live births. And young mothers who are giving birth result in about 200,000 deaths per year. The causes are generally preterm birth, low birth weight, newborn asphyxia, and maternal labor complications. I want to talk a little bit about the implications of child marriage. So, about 142 million girls worldwide will marry before the age of 18 within this decade, with India having the highest rates of child marriage. Now, 44% of rural girls will get married prior to the age of 18, compared to just 22% of urban girls. Now, culturally, this tends to happen in patriarchal societies where the parents and elders select spouses for their children. The new brides are married in for domestic help, and they're married shortly after puberty for optimal childbearing capabilities. Their virginity is tied to the family's honor, and child marriage also prevents children being born out of wedlock. However, the health burdens are extensive. Childbearing is expected following marriage, and these young maternal ages cause extensive pregnancy and childbirth complications, which are the leading cause of death for girls aged 15 to 19 in low-income countries. These young mothers are twice as likely to die during childbirth, and children are also more likely to die when the mothers are young. If the children are born, they have low birth weights, weak immune systems, and are often malnourished, which is why India has one of the higher rates of infant mortality in the first year of life. Now, in terms of risk factors, inadequate contraceptive use or just inaccessibility to contraceptives, the young marriage ages, particularly in rural areas, being povertous and having a lack of resources, incomplete immunization statuses of both the mothers and then the children when they're born, delayed breastfeeding initiation, and poor nutritional status of the mothers. They actually found that over half of all married women in India are anemic and 1/3 are malnourished. Reviewing the research, I looked into the effect of maternal child marriage on morbidity and mortality of children under 5 in India, and also the effects of young maternal age and short interpregnancy interval on infant mortality in South Asia. And what was found was that young maternal age, or those less than 18 years old, and short interpregnancy intervals, or less than 24 months between each child, resulted in 23 to 26% of infant deaths in India and Pakistan. Now, the World Health Organization and UNICEF has developed Millennium Goals, with number 4 being to reduce under 5 mortality by 2/3 between 1990 and 2015. India and Pakistan, however, are not at all on track to achieve this goal. The results of these studies here highlight the importance of delaying marriage and childbearing and improving the use of contraceptives among young people as a means of reducing infant mortality rates. I also wanted to share a little bit about the lifetime risk of maternal death in industrialized countries. It's just 1 in 4,000 versus 1 in 51 in least developed countries. Now, taking a look at the life expectancy across the globe, the Americas have, a range of 70 to 87, whereas India 60 to 69 years of age. However, I wanted to show this because this number here has increased significantly over the years. And one reason for child marriage and young maternal ages may have been also due to the fact that life expectancies were much lower. But now that this number is steadily increasing in India, it may be beneficial to look into delaying marriages and childbearing of young mothers in order to increase their life expectancies. Now, how do we bridge the cultural gap with these grim statistics? As a CNL, there are many steps that we can take to reduce infant mortality in India, Number one being preventative care, providing healthcare resources for the rural areas, nutrition and pregnancy counseling, immunization access, transportation so people can get to and from healthcare facilities, and also contraceptive accessibility. Education being a second one, just educating families, especially in the rural areas, about the risk factors of young maternal ages, and then um, teaching young mothers about using contraceptives prior to a certain age and also using contraceptives between pregnancies. Third is identifying high risk pregnancies early on, with proper screening, and then providing outreach services before and during pregnancy, and then of course during labor as well, to reduce all those complications during labor. And lastly, reducing environmental factors such as contaminants, introducing clean water systems, teaching them to cook outside of the home if using fire, and then implementing sewage and waste removal systems. So essentially what we want to do is educate and fight for policy changes that are still culturally sensitive, and look at why these rates in India are so much higher, and to educate the population on what they can do to better um, their infant mortality rates. Thank you so much for listening. Here's my references.